So, the principle of professional responsibility is rooted in a deep commitment to the welfare of others. Ethics plays a critical role in shaping our professional obligations and directly influencing workplace standards. In today's discussion, we will focus on the importance of professional competency and explore how ethical principles apply within the workplace. Additionally, we will address several hot button topics that are particularly relevant to our field. Finally, we will close by emphasizing the vital role of integrity and empathy in the meaningful work that we do. It's essential to recognize that professional competency exists on a continuum. Competency encompasses not just the quantity of the time spent in the field, but also the quality of that time. Professionals must stay current with trends, utilize validated tools, and implement evidence based practices. Furthermore, true competency requires multicultural awareness and a willingness to work with diverse populations in a non judgmental and inclusive manner. Professional competency also involves pursuing areas of expertise and specialization that align with one's career interest. For example, some individuals may have a strong desire to work with veterans or populations impacted by trauma. To demonstrate expertise in these areas, professionals often seek advanced certifications or credentials that reflect their focus and commitment to these specific needs. At the same time, it's important to recognize that counselors are human beings such as life events, whether physiological, psychological, social, or emotional, can impact a professional's ability to function effectively. An impaired professional refers to someone who has experienced a loss of normal functioning that could compromise their work. This may include addiction to drugs or alcohol, significant medical conditions, surgeries that require medications affecting day to day performance. Impairment can have consequences for the professional's relationships with clients and colleagues, their reputation, and even the reputation of the field, whether on a short term or long term basis. Navigating these challenges uh, posed by impaired professionals requires awareness and collaboration. Many programs exist to support impaired professionals in returning to safe and effective practice. In addressing these challenges, self care becomes an essential component of professional responsibility. Trust is the cornerstone of the work that we do, and as such, professionals must first take care of themselves in order to care for others. Continuous self monitoring is critical. This includes evaluating personal biases, values, attitudes, and beliefs, as well as recognizing transference and countertransference that may arise in the therapeutic relationship. To sustain longevity and effectiveness in the field, professionals must prioritize ways to quote unquote fill their tanks, engaging in restorative practices that maintain their well being and capacity to give back to others. Supervision, training, and teaching are essential components of both self care and ongoing professional competency. These elements serve to foster meaning and purpose, regardless of the professional role, whether you're engaged in clinical supervision, part of a training program, an educator, a student, or a professional counselor. The overarching goal is to promote growth and understanding and meaning in the work that we do. Supervisors, in particular, play a critical role in monitoring not only the services provided by supervisees, but also their ability to safeguard the welfare of the clients. In essence, supervisors bear responsibility for the client's relationship managed by their supervisees. This makes regular, informed, and meaningful supervision essential, where consultation can address critical areas such as self care, transference, countertransference, and client's progress or lack thereof. Supervisors must also guide supervisees in adapting treatment methods and modalities to ensure clients receive the best care possible. Staying current with technological trends is another crucial aspect of ongoing competency. For instance, the rise of telehealth, particularly as a result of the COVID-19 pandemic, has brought about a shift in the service delivery method. This shift raises important considerations regarding expertise, scope of practice, and most critically, confidentiality for clients. Professionals must ensure that they are compliant with HIPAA laws and confidentiality guidelines to provide treatment that remains both secure and ethical. Growing and developing occurs on multiple levels within this framework. Counselors, supervisors, and ultimately clients will all experience growth and development as part of this parallel process. Supervision, training, and teaching are opportunities to refine and enhance professional skills, ultimately improving the quality of services provided. A multicultural lens must also be central to this process. Professionals are tasked with developing cultural competency, demonstrating respect for diversity, and maintaining a non judgmental approach to clients. This requires self awareness, recognizing one's personal values, beliefs, and attitudes, while actively seeking supervision to address areas where biases may arise. It's crucial that professionals refrain from imposing their values on clients, as doing so can inflict harm and violate ethical principles. Ultimately, supervision, training, and teaching are ongoing processes that support professional accountability, self improvement, and the delivery of culturally sensitive, high quality care. By fostering meaning, encouraging growth, and remaining committed to ethical and evidence based practices, professionals can ensure their competence continues to evolve and meet the needs of those that they serve. Many individuals in this program express a very strong interest in pursuing professional licensure, and this process brings up several important questions as it is essential to recognize the ethical standards that play a critical role in licensure and credentialing. As professional counselors, it is our responsibility to provide an accurate representation of who we are, the credentials that we hold, our degrees, our accreditation status. It is worth highlighting that you are part of the KCREP accredited program, excuse me. This accreditation is significant and it ensures that your completed hours meet the rigorous standards of necessary work towards professional licensure or additional credentials. Additionally, we strongly encourage individuals to seek professional memberships, such as with the American Counseling Association, the ACA. Memberships within such organizations provide invaluable opportunities to network, gain access to current resources, and stay informed on the latest research and developments in the field. For those with specialized interests, pursuing memberships or certifications tailored to your area of expertise can further enhance your professional development. For example, if you're particularly passionate about trauma, you may consider joining the International Association of Trauma Professionals or pursuing relevant trauma certifications. Similarly, individuals interested in addiction counseling can explore certified addictions counselor credentials or peer recovery support specialist credentials. There are countless opportunities for additional certifications and credentials, and I encourage you to reflect on your area of interest, whether it be trauma, addiction, or other specialized populations. Investing in professional development allows you to refine your expertise, advocate effectively for your clients, and strengthen the counseling profession as a whole. By enhancing your knowledge and skill set, you not only contribute to your ongoing professional growth, but it also upholds the values of competence, integrity, and social justice that are at the heart of our work. While pursuing licensure as a professional counselor, it is essential to understand the role and responsibility of clinical supervision. As a clinical supervisor carries significant responsibility and liability not only for the work of the supervisee, but ultimately for the welfare of the clients under their care. Given this high level of accountability, clinical supervisors must also adhere to the highest ethical standards and demonstrate competency in the field. In the state of Pennsylvania, to obtain a licensed professional counselor (LPC) credential, candidates are required to complete 3,000 hours of supervised clinical experience. These hours must be earned post master's degree, and the process demands a committed, ethical, responsible supervisor. To fulfill this requirement, you have the option to complete the entire 3,000 hours under the supervision of an LPC, or you could split supervision hours with half of the hours, so up to 1,500, under a licensed clinical social worker, LCSW, and the remainder under a qualified LPC. The state of Pennsylvania permits collaboration between these professional disciplines for licensure supervision. However, it's important to ensure that the supervisor meets the specific qualifications outlined, and they must be licensed in the state of Pennsylvania, have a minimum of 5 years of clinical experience within the last 10 years of practicing as a professional counselor, and demonstrate the ability to provide consistent, ethical, and competent supervision throughout the process. As you seek a clinical supervisor, it's critical to select someone who is both qualified and committed to supporting you ethically and professionally. There is guidance that will not only help you meet the licensure requirements, but also ensure your continued growth as a competent and ethical professional counselor. In the state of Pennsylvania, the licensed professional counselors, again, LPCs, are required to meet continuing education requirements. and these are to help maintain your licensure. These requirements need to be filled every 2 years as part of the license renewal process. So let's talk a little bit about these. LPCs need to complete 30 clock hours of continuing education every 2 years. Online training as of November 2019, the state recognizes that CE hours can be completed entirely online. Face to face in person training is not mandatory, reflecting significant advancements in technology and clinical education. LPCs need to complete 1 hour of continuing education specifically focused on assessment, treatment, and management of suicide risk. This requirement ensures counselors remain equipped to address clients presenting with suicidal ideation, intent, or planning. Ethics training, LPCs must complete 3 hours of continuing education in ethics as part of their total required hours. When some professionals express fatigue with repeated ethics training, it's important opportunity for ongoing growth. Ethical dilemmas in the counseling field are ever evolving and new issues continue to emerge. Taking a variety of ethics related courses provides fresh perspectives and fosters a creative, ethical problem solving approach. LPCs must complete 3 hours of mandated training for child abuse recognition and reporting standards. This training is required prior to the initial licensure application, and it's also required every renewal period thereafter. This ensures LPCs understand their legal and ethical obligations as mandated reporters of suspected child abuse. In this module, resources have been provided to support your understanding and completion of these requirements, and this includes state specific licensure FAQs and guidance, detailed information on CE requirements, and links to complete the 3 hour child abuse and recognition reporting training. While it's not mandatory to complete the child abuse training as part of this course, this link has been made available for those who wish to take the initiative and fulfill this requirement in advance. Continuing education is going to be an absolutely vital part of professional growth and development, whether that's addressing suicide prevention, ethics, or child abuse reporting. These trainings ensure that LPCs stay current with emerging trends, maintaining ethical standards, and continuing to provide the highest quality of care for clients. Okay, as we transition into hot button topics within the professional ethics field, this module will address critical issues such as discrimination, non discrimination, dual relationships, and sexual harassment. These topics are integral to understanding and maintaining ethical conduct within the counseling profession. This module offers a wealth of information on these areas, ensuring that you are equipped to navigate complex ethical scenarios. So, we are going to talk about some various different key points and really review and further reflect. So, understanding these ethical challenges is essential for fostering professional integrity, maintaining trust, and upholding the highest standards of care for clients and colleagues alike. First, let's move to discrimination. This is often synonymous with prejudice, bias, bigotry, intolerance, or inequity. It refers to the unjust and biased treatment of individuals or groups based on specific characteristics. These typically include race, ethnicity, age, gender, identity, sexual orientation, substance use, addictive behaviors, and mental health disorders. As professional counselors, it is our ethical responsibility to ensure we do not engage in, endorse, or condone discrimination in any form. This applies not only to current and prospective clients, but also to families, students, employees, volunteers, supervisees, and research participants. To uphold the highest ethical standards, we must actively guard against discriminatory attitudes and behaviors, and this includes identifying and addressing values, attitudes, beliefs, and potential transference that may create ethical concerns. Supervision and consultation, again, are going to be essential tools for exploring personal biases, filling knowledge gaps, and ensuring non discriminatory practices. By upholding ourselves and our colleagues accountable, we foster a professional environment rooted in equity, respect, integrity, and ultimately enhancing the well being of those that we serve. Next, we move on to non discriminatory services. Professional counselors are ethically obligated to provide services that are non discriminatory and non judgmental. Counselors must refrain from exploiting clients, supervisees, and others within professional relationships and should remain vigilant about maintaining appropriate boundaries to prevent ethical violations. It's important component of ethical practice that includes pro bono work, which reflects a commitment to the welfare of underserved populations without the pursuit of financial gain. Counselors are reminded to avoid behaviors that may benefit them financially or create conflicts of interest, such as engaging in dual relationships, accepting bribes, unethical bartering, or gifting. Counselors must operate strictly within their scope of practice, expertise, and competence to protect both themselves and those they serve from potential harm. Recognizing one's professional limits requires ongoing self awareness and transparency. Trusting your intuition and seeking consultation and supervision is key when doubts arise. Common experiences like imposter syndrome may occur. However, counselors must move beyond the hesitation and openly ask critical questions. Asking oneself, is this outside my scope of practice? When does referral or termination become appropriate? How can I adjust or enhance my skills to meet my clients' needs effectively and ethically? By fostering open communication with supervisors and colleagues, counselors can confidently navigate ethical challenges while upholding professional standards, ensuring the welfare of our clients. The counseling relationship is inherently unequal due to the counselor's position of power and authority. Counselors must remain aware of how this power dynamic impacts the relationship, particularly regarding client safety and the potential for exploitation. When boundaries are blurred, especially through dual relationships or relationships with current or former clients, the therapeutic environment can become harmful. Ethically, dual relationships, whether personal, financial, or professional, should be avoided as they compromise objectivity and may cause harm to the client or to the profession. While ethical guidelines note that relationships with former clients may be permissibly at 5 years post termination, their circumstances will still require careful consideration. So, one must really think about the power dynamics and the residual influence, the privilege and the potential harm to the client, and then the intent and the counselor's role in reestablishing the contact. So, counselors are strongly advised to approach such situations with extreme caution, engaging in ongoing supervision and consultation to avoid crossing ethical boundaries. We need to talk about conflict of interest, which arise when a counselor's personal or professional interests interfere with their ability to act in the client's best interests. Examples include entering into relationships for personal gain, exploiting the client's skills or services. For instance, if a counselor works with a client skilled in home construction and later considers hiring them to build a home, this situation introduces ethical conflicts due to power imbalances, intent, and potential personal benefit. So, some key questions to ask ourselves here may include, what is my intent in this situation? Is this decision in the client's best interest or is it for my personal benefit? And how could the impact of this impact the therapeutic relationship or the profession? So, in such scenarios, the counselor must prioritize transparency through disclosure and consult supervisors to avoid ethical missteps. Counselors must intentionally refrain from using personal, professional, or political power for personal profit or gratification or achievement advancements. This principle is critical for maintaining trust, integrity, and client welfare. When in doubt, counselors should seek consultation and supervision to ensure the decision aligns with ethical standards and avoids triggering any potential red flags. By honoring these ethical principles, counselors can uphold the highest standards of the profession while safeguarding clients and avoiding harm by conflicts of interest. Sexual relationships, contacts, and harassment are explicit violations of professional standards and are strictly prohibited within the field of counseling. These ethical boundaries apply not only to physical acts, but also verbal and nonverbal behavior. Examples of nonverbal violations include inappropriate touching, physical contact, body language, sexual advancements, whether consensual or not, and with or without penetration. So, even seemingly innocent acts like offering a hug or touching a client's hand can blur professional boundaries if not handled with care. As professional counselors, we must be highly sensitive to the context in which touch occurs. In environments like addiction recovery, where hugs are common, it is essential to gauge the appropriateness of such interactions. Touch should always be non sexual, non coercive, and respectful. If it is important to set boundaries early and to ensure that all interactions, even those that may seem compassionate, do not cross into the realm of impropriety. Assessing potential conflicts of interest, power dynamics, and how touch may be perceived by the client is going to be critical. A good rule of thumb is to be aware of how your actions may be interpreted by the client. What feels like supportive gestures to you may be perceived differently by a client, particularly if they're vulnerable or have experienced past trauma. To avoid potential violations, counselors should actively engage in self reflection, exploring their motivations and personal and professional dynamics that may affect their behavior. Verbal violations include using inappropriate sexual language, asking personal sexual questions that have no relevance to the treatment process, or engaging in conversations that shift the focus away from the therapeutic goals. If the counselor feels compelled to ask personal sexual questions, it will be crucial to explore the reasoning behind this behavior. The impulse could be rooted in countertransference, where the counselor's own issues or unresolved feelings are projected onto the client. Counselors should be vigilant in identifying these dynamics and seek supervision or consultation when they feel uncertain or conflicted about their behavior. Being transparent with supervisors or colleagues can help avoid ethical violations. Sexual relationships with current clients are, again, strictly prohibited, including those that occur through virtual platforms. This prohibition also extends to former clients for a period of 5 years after the last professional contact. This 5 year rule is part of the ethical code to mitigate the risk of exploitation, considering that counselors hold a position of power over clients. The ethical line is often difficult to navigate, and it's advisable to avoid relationships with former clients altogether, as a risk of harm remains significant even after the 5 year period. So, my personal advice to you is just don't do it ever. End of story. In addition to ethical prohibition, engaging in sexual relationships with clients is also a criminal offense in many states. I bet you didn't know that. Legal ramifications can include criminal charges, lawsuits, and loss of licensure. Counselors must be aware of the laws in their state regarding sexual relationships with clients to understand the full scope of potential consequences. Counselors must establish and clearly communicate emotional and physical boundaries with clients from the outset of the professional relationship. This includes discussing boundaries when issues like hugs or physical touch arise. Open, transparent conversations about these boundaries are vital to maintaining a safe and ethical therapeutic environment. Even if a situation feels uncomfortable or difficult, it's essential to address it head on rather than avoiding the discussion. A counselor's ability to lean into these challenging discussions benefits both the client and the profession as a whole. By doing so, counselors ensure that they are upholding the highest ethical standards and protecting clients from the potential harm while safeguarding the integrity of the counseling profession. Sexual attraction. It's not uncommon for counselors to experience feelings of sexual attraction towards a client at some point in their career. While these feelings themselves are not unethical, acting on them is a clear ethical violation. This distinction underscores the importance of self awareness and self reflection in professional counseling relationships. Counselors must always process and address these feelings in a manner that adheres to ethical guidelines, ensuring that therapeutic relationship remains focused on the client's needs and well being. So let's take a case study here of Drew and Alex, and we're going to examine the principles and the codes of conduct relevant to a case study involving these two. In a scenario, Drew is the counselor, and he has developed a close personal relationship with Alex, who is the client. Although no romantic relationship has been initiated, both have expressed a desire to do so once Alex's treatment is concluded. They have agreed to wait 6 months before pursuing a relationship. So, we need to talk about some ethical concerns and boundaries here. Exploitation of power and professional boundaries. So, the primary concern in this case is the exploitation of the counselor client relationship. Drew is in a position of power and influence over Alex, and any romantic relationship, whether initiated during or immediately after treatment, risks exploiting the vulnerability inherent in the therapeutic relationship. Even though Drew and Alex agreed to wait 6 months, the potential for exploitation remains high. The ethical guidelines state that relationships in current counseling relationships are strictly prohibited, and for those former clients should be avoided, especially during the 5 year post treatment period. Now, this situation also creates a conflict of interest for Drew. The counselor's primary duty is the well being of the client. Any personal or romantic involvement could impair Drew's ability to objectively assess Alex's needs, potentially interfering with the therapeutic process. Furthermore, if the relationship were to be initiated post treatment, questions of intention and exploitation could still arise. Alex, as a client, may not fully grasp the power dynamics involved in the counselor client relationship. Even though both parties believe the attraction is mutual, Alex may be emotionally vulnerable during treatment, which could cloud the judgment or lead to emotional attachment. The counselor must be aware of these dynamics and ensure that these decisions are not influenced by personal feelings, but instead are in the best interest of the client. The ACA Code of Ethics, along with other similar codes, they explicitly prohibit romantic or sexual relationships with clients. It's impossible to maintain an unbiased professional perspective while in such relationships, even when the agreement to wait 6 months complicates the situation, as it may influence the course of treatment and the counselor's professional objectivity. So, how do we manage this ethical dilemma? Well, self reflection and professional accountability will be very important here. As Drew would it would be essential to acknowledge the process and the attraction to Alex as part of the professional and personal self reflection. Supervision, again, you'll hear it time and time again, is going to be critical here. As Drew seeks guidance from more experienced counselor or a supervisor to navigate these feelings and the ethical concerns that they raise. Ongoing consultation could help clarify how to manage these feelings of attraction that may arise and ensure that personal feelings do not impact the treatment process. One ethical response would be to refer Alex to another counselor for treatment, ensuring that there's no continuation of the professional relationship that could lead to blurred boundaries. This referral would protect both the client and the counselor from potential ethical violations, and it would be important for Drew to make the referral with respect and care, explaining that the referral is necessary to maintain the integrity of the therapeutic process. We could also use an ethical decision making model to help Drew analyze the situation objectively. The model would include identifying the problem, which is the attraction between Drew and Alex, as the potential for a future romantic relationship. We also need to consider ethical principles such as client welfare, non exploitation, and maintaining professional boundaries. We also need to evaluate possible courses of action, such as continuing treatment with boundaries, referring the client to another professional, or waiting for the post treatment period. Consultation, seeking advice from colleagues or supervisors to explore all options and consequences. And then lastly, deciding upon an action and taking steps to uphold ethical standards and professional integrity. Documenting decisions and actions. Again, you've heard it before, document, document, document. Regardless of the course of action, it's going to be important for Drew to document the situation, including any conversations with the client, supervisory consultations, and the steps taken to resolve the issue. Documentation ensures transparency, accountability, and protects both the counselor and the client. So, what if you were Drew? Well, if I was Drew, I would likely feel conflicted and uncomfortable about the situation, acknowledging the importance of boundaries and professional conduct in all therapeutic relationships. I would seek immediate supervision and consultation to gain a deeper understanding of my feelings and how to manage them ethically. My course of action would involve referring Alex to another counselor and ensuring that the transition was handled in a professional and caring manner. I would also address the situation with Alex in a way that is respecting their emotional experience while clearly reinforcing the ethical guidelines of the profession. So, what if you were a counselor working with a client who expressed attraction? Again, if I were working with a client who expressed sexual attraction, I may take several steps by first acknowledging the client's feelings in a professional and non judgmental way, understanding that the attraction is a natural human experience. I would calmly and clearly reaffirm the professional boundaries that govern the therapeutic relationship. I would explain that romantic and sexual relationships are not appropriate and would be a violation of ethical standards. If I felt unsure about how to handle the situation, I would seek supervision or consultation with colleagues to ensure that I maintain ethical and professional conduct. And then throughout the process, my goal would be to ensure that the client's emotional needs are addressed in a supportive way without compromising the therapeutic relationship. So, in both cases, it's essential to prioritize the client's well being while adhering to the ethical principles of the profession. The primary responsibility is to maintain professional boundaries, prevent exploitation, and avoid any behavior that could cause harm to the client or undermine the integrity of the counseling profession. Ongoing self reflection, consultation, and supervision, again, are going to be key tools for navigating these complex ethical dilemmas. We need to talk about sexual harassment, which is a serious violation of professional and ethical standards in the workplace. The counseling environment and other professional relationships, including supervisor-supervisee dynamics. It is essential for counselors and other professionals to be aware of what constitutes as sexual harassment and the potential consequences, as well as the ethical and legal responsibilities involved in preventing such behavior. Sexual harassment can take many forms, impacting not only directly the victim, but also the larger work or therapeutic environment. In the counseling profession, it's particularly important to recognize that harassment can arise in multiple contexts. So, first, we talk about the client counselor relationship. Any sexual advances, requests for sexual favors, or other inappropriate verbal or physical behavior from a counselor or a client can constitute as sexual harassment. However, it's crucial to note that harassment does not always involve direct, overt sexual behavior. Subtle actions such as inappropriate comments, suggestive body language, questions of a personal or sexual nature can be perceived as harassment by clients and colleagues. The next dynamic we need to look at is supervisor supervisee. In the context of supervision, harassment can occur if a supervisor behaves inappropriately with a supervisee. This could include making unwelcome sexual comments or advances, creating a hostile or sexually charged work environment, or using their position of authority to manipulate or coerce a subordinate into unwanted sexual behavior. Workplace or learning environment. As professionals, we must acknowledge that harassment can extend to beyond one on one relationships to the broader workplace or organizational culture. For example, comments made in a common area like a break room or a water cooler, even if not directed at a specific individual, can be construed as harassment if they create an uncomfortable environment for others. This can include negative or discriminatory comments about gender, sexual orientation, or identity that has negatively affected individuals in the vicinity, even if the comments were not directly intended for them. Now, we have the Equal Opportunity Commission, the EEOC, which provides important guidelines on understanding and addressing sexual harassment in the workplace and other professional environments. Sexual harassment can include, but it's not limited to, unwelcome sexual advances, so any request or suggestions of sexual nature that is unwanted or unsolicited. Requests for sexual favors, any attempt to pressure someone into sexual conduct in exchange for professional advances or privilege. Other verbal or physical harassment, this can include inappropriate jokes, teasing, sexually suggestive comments, touching, or body language that makes the individual feel uncomfortable or unsafe. And a key element in defining sexual harassment is that the conduct is unwelcome. If a person expresses that the behavior is not wanted or does not want to consent to it, then it can be considered harassment, even if no formal complaint is made. Importantly, harassment does not need to result in economic harm or loss of a job for it to be deemed unlawful. For example, negative comments or actions to create a hostile or intimidating work environment, even without financial consequence, are still problematic. Sexual harassment is not limited to behavior directed at individuals of a particular gender. It can be between people of any gender or sexual orientation. The harasser and the victim may be both men or both women, or they may have different genders. Additionally, individuals who are not directly targeted by the harassment, such as colleagues who witness inappropriate behavior, can also experience negative emotional effects, creating a toxic workplace. This is why it's crucial to understand harassment even when the victim is not the person directly involved in the act. It's essential to approach sexual harassment discussions and policies in a gender neutral manner, recognizing that harassment can occur across all identities and orientations. Counselors must be proactive in creating and maintaining safe, respectful, and non harassing environments for both clients and colleagues, and this includes establishing professional boundaries early and consistently with clients, colleagues, and supervisors. Boundaries must be respected, and any behavior that crosses those boundaries should be addressed immediately. Continuous education and training on sexual harassment policies and ethics standards are essential. Counselors should regularly engage in supervision and consultation to address any potential issues or concerns related to harassment and boundary violations. If a counselor is unsure on how to navigate an ethical dilemma related to harassment or any other issue, they should seek supervision or consultation with colleagues. This helps to ensure that the counselor is acting within the ethical guidelines and maintaining a professional demeanor. If harassment occurs, it is important to address and according to the ethical standards of the profession. Counselors must be familiar with reporting procedures in their workplace and their organization to ensure that they are ready to take action if necessary. Counselors should be aware of their clients' comfort levels and be prepared to respond when they express concerns about inappropriate behavior, whether from the counselor, other clients, or colleagues. Ensuring a safe and non-exploitative environment is central to an ethical practice of counseling. So, again, sexual harassment, whether in the counseling environment, workplace, or supervisory relationships, is a serious violation of professional ethics and legal standards. As counselors, it's crucial to establish clear, respectful boundaries and maintain a safe, non judgmental environment for all individuals. Regular training, consultation, and commitment to ethical conduct are essential to prevent harassment and to ensure that we are upholding the dignity and safety of clients and colleagues that we work with. So, where do we go from here? Integrity. This is the foundation of our work for ethical conduct. Integrity is choosing courage over comfort. It is choosing what's right over what is fast or fun or easy. And it is practicing your values, not just professing them. It is essential to continue approaching all individuals with empathy rooted in trauma-informed framework. The concept of sanctuary exists within the workplace, shaping the culture in which we collaborate both with colleagues and clients. Empathy serves as the most powerful tool that we have for building connections and trust by saying, I see you and you are not alone. We acknowledge the shared human experience, recognizing that while we may not have all the answers, we remain committed to listening and asking thoughtful questions. This approach fosters a deeper understanding, helping others feel heard. Many of us experience similar challenges, so how can we normalize these experiences and open up the broader discussions? Perhaps a better way to frame this is, now, how can we normalize a wide range of emotions we all go through? No one is alone in feeling this way. By working collaboratively, we can create an environment where everyone feels supported and valued. Let's wrap it up. I want to emphasize the importance of competency in counseling and the core values that guide our practice. As you leave this course, I encourage you to be brave in recognizing the necessity of setting clear boundaries and applying this principle to your professional work. Embrace difficult conversations, engage with others in a collaborative, trauma informed way. It is not about talking to people or about people, but with people. Demonstrating integrity, empathy, and leadership in your practice is essential as these qualities serve the work and enhance the client experience. Take responsibility for your role in the community as the leader and as someone who sustains positive change. Be mindful of the energy you bring into the profession and how you adapt. Given the things that are constantly evolving, individuals we work with have diverse needs, and it's important that we recognize that not a one size fits all approach, it just simply doesn't apply. Competency is a continuum. It's about having the ability to adapt, not being rigid, but being willing to modify your values, theoretical orientation, or interventions when something's just simply not effective. You need to take good care of yourself and treat others with respect, responding in a professional and timely manner, and making sure your words hold meaning for yourself and others. If you're unsure of an answer or you need to research something, be honest and communicate a timeline for when you will follow up. Practice gratitude and remember that we don't have to do this work. We are privileged to do this work. Being part of the helping profession is a blessing, and it's important to recognize and appreciate the gratitude that surrounds us. Be mindful of others' time too, setting boundaries that allow you to give yourself the full attention necessary. And if you can't communicate that and you're unable to focus because you're managing a crisis or completing other tasks, let your colleagues or your clients know when you'll be available to them. Timely sessions are vital, but if things run over, ask someone to inform your clients that you are in a crisis and that you will be with them as soon as possible. Ultimately, reflect on who you are as a professional, what your responsibility is, not only to serve the work well, but to also be brave and take care of yourself and to lead with gratitude in your professional life. Thank you for your time and attention, and I'll see you in our next lecture.